Dr. Jiang.
Okay.
I came in Ghana 1994. So we started the Beijing clinic from 1996 up to now. We are mainly dealing with stroke treatments,
Okay.
pain management, and those difficult and miscellaneous disease. So we treat the patients or the illness from the different view and idea.
Okay.
Try to give them help. But for the past getting nearly to 30 years, I think we are quite all right.
Wow.
In the people being recognized. I'm learning the Chinese medicine, acupuncture, and massage in
Okay.
Beijing TCM University. And Beijing TCM University, TCM is the traditional Chinese medicine, is one of the leading university in China and is located in Beijing. So by the government directions or appointees as the best of the university. So there is the three best university of Chinese traditional medicine. One is in Beijing, one is in Guangzhou, and one is in Shanghai,
Okay.
those biggest cities. We do Chinese medicine, we do acupuncture, we do massage, especially we joined with the new treatments, like the latest technology in China we call acupotomy.
Okay.
Acupotomy is very effective treatments. We can say more than 10 times, even 20 times more than acupuncture, because generally everybody understands what is acupuncture. But for the olden Chinese time, acupuncture, that's small tiny needles, is just part of the whole acupuncture system. So acupotomy, the name we can say that is the acupuncture joint anatomy. We
Okay.
put the name together, we call acupotomy, which is very, very effective.
Okay.
And the effective rate, for example, like our staff, Mr. Isaac, when he treats the people, even I don't do that one.
Okay.
If it's simple disease, like the pain management, everything, after first time treatments, we can reach the results from 80 to 95% if it's simple disease. So that's why, I'm already Ghanaian,
Okay.
and I'm here for a very long time now, and also I'm a Christian. So for those simple disease, whoever come into Beijing clinic, even we don't have time to ask what is your previous medical history, this and that, we just divide it. If you have the waist pain, we have some simple acupuncture points.
Okay.
We use the acupuncture needle to just treat it. God can say forever, we cannot say forever. We just manage.
Okay.
We know, we understand a little bit for the sickness, then we try to help them, because we can't say forever, because when we are moving, we are eating, we are doing this and that, it will coming back. The fascia, the muscles will getting tight and everything. We just manage. So we release the suffering, we release the pain for the patients. That is our target. Oh, the track records this year's not that much, but in 2006 we awarded like Excellency Award in Herbal and Alternative Medicine, and Dr. Nkrumah Excellency in the Enterprise Awards for 2007. So later on, we are concentrating our clinical work, so we don't attending for those issues. As for the stroke, we have a common understanding. We have two different types. One is short of the blood supply. Another one is we call ischemia stroke. Another one is too much pressure. The vein has been boosted in the brain. That's why we call it how to put into English. Is a big area that the brain has been affected by the pressure, the bleeding from the brain. So that is two main issue for the stroke.
Okay.
The clinically, the ischemic stroke is more than others. The main causes is because of three high. When it says three high, number one, hypertension, which is a high blood pressure. Number two is high sugar level, which is diabetes.
Okay.
Number three is the high cholesterol.
Okay.
So these three issues, when you diagnose it and you don't manage very well, you will see that if the person manage with these three facts, three high level, then they can be postponed. They can be they can be even 10 years, 15 years, 20 years, they never get stroke. But since they have diagnosed with hypertension, diabetes, high cholesterol, and you ignore it, then will be a fact, will be a problem. Then will be easily get stroke, even 5 years. And another one is 10 years. You manage half, sometimes you take medicine, sometimes you don't take medicine, you know, on and off, on and off. Normally 10 years, run away from the stroke. You get the big attack because the many small stroke, which is the early sign of the stroke. Sometimes the people, they just ignore it, which is very bad. Sometimes it's from the family even. Like many people clinically, if they have history of diabetes, hypertension, then the family member will easily to get it. The stress of during the work. Now this time, the people who involve stroke, the age is getting earlier, like 40 years, 45 years. Normally from 50 years going, but now clinically we can see the age is coming earlier, like 45. Warning sign is a lot. We can say we understand the warning sign is we say be fast. B is balancing. If the person, they walk in balance, they lost balance. One side is getting numbness, getting tired, getting weaker. Then first one is the balance. B fast is B-E, E is for eye. You know, sometimes the eye getting like blood vision, and they feel dizzy, also part of the eye issue. Fast is F. F is the fissure. You see the fissure is getting paralyzed. So another one is a B fast is A. A is arm. You see the arm cannot resonate up. It's difficult, feeling very serious, stiff. And S is speed up. So be fast. You should be, when you see those signs, you should be quickly go to see the doctor. T, be fast is the last word is the T. T is timing. So the most important is timing. Whoever have the early sign of the stroke, then quickly rush, go to see your doctor. Because that the first 3 to 6 hours, you have those signs, you have dizziness, vomiting, you quickly go to see the doctor, because the golden time to treat for stroke or manage with stroke, due to manage with the BP, due to manage with the bleeding, due to manage with the ischemic change from the brain. So the first 3 to 6 hours is most important. But if you already delayed, but don't delay it for another 48 hours, which is 2 days, then quickly go to see your doctor. Have to check if you concentrate your health, you want to live longer. Once a year, complete checkup is very necessary. So once a year, complete checkup, especially the age more than 45 years old, because 45 is our golden time. It's the golden age is going down. The hormone system, everything is going down already. So by that time, many sickness may come to worry you. So you have to quickly check to see what is the health condition are. Then from the laboratory, you have to take notes. If the laboratory shows you have cholesterol high, they have to reduce those oil foods or fried foods to take. If it's already showing like uric acid is high, of course you have to stop those beer, seafoods. You have to manage yourself. Our patients already used to our system, because in the clinical treatment life, we always face into those critical conditions. Many people, they are coming to us already is last minute. So normally we do complete checkup for the first visit, because we have to know the condition. Sometimes you don't see the people are really sick, but internally kidney problem has already there, liver problem already there, ESR shoot very high, uric acid is very high, cholesterol is very high. So normally we recommend the people to do once a year for checkup. Then also coming to us, you may have problem already, so we do complete checkup to understand it, because we don't want to close the eye to drive. We have to understand your condition. That is by the laboratory side, this and that. Then if already is early sign of the stroke already, then we may send them to do the MRI, CT scan, ECG, those so many things. And for us, you know, early age in China, we don't have CT scan, we don't have X-ray like 100 years ago, 200 years ago. We use the old method, Chinese methods. diagnosis from the tongue.
Okay.
That's one I can see that
It's
it's
effective.
very effective. When you open the tongue, then we can see so many things on the tongue. That's why I prepare some documentation. Maybe next time we can show whatever. It's easy to diagnose. Even in the house, when you pull the tongue outside, you see the tongue is seriously shifted to one side. Be careful, stroke.
Okay.
Then when you open the tongue, the end of the tongue, you know, there's some vessel, some veins. If the veins is germinated or enlarged very big, you should be careful. Mode of treatment, we have so many, including Chinese medicine, which we call NST 400. In English, we also give a name like Brainwell, Brainwell capsules. We have already released with Food and Drug Board for many, many years now. That is our key product to manage with the stroke. Then part of that, we have a lot of herbal infusion. Those herbal infusion is working for the microcirculation, and also reduce the cholesterol, everything. Then, of course, we have acupuncture, we have physio, we have acupotomy. Still, it's acupotomy because acupotomy is developed in China just recently, 20 years.
Okay.
But the idea of acupotomy is so many different idea of it. The one what we are using for the patients, which we can see is very, very effective. When the people, the family carry the person coming in by the first day, they work out by the same day. But if you are delayed, you know, like 5 years, 10 years, then we just can manage to release the tension. Because the stroke, later on, first of all, is the brain has a problem. Brain is our headquarters in the body. So when the brain has a problem, the circulation for the body, any part of the body will be choked. Later on, the nerve will be choked, muscle will be choked, fascia will be choked, you know, lymphatic system will be choked, nerve system will be choked. So we use the acupotomy plus those medicine infusion to release those nerve choke area.
Okay.
What we're understanding, what is the sickness? Who show you the sickness? Who show you the pain? Who show the suffering for you? It is the nerve.
Okay.
So what I'm understanding now, the sickness is the nerve sick, because nerve give you signal to tell you, oh, I have the pain here.
Okay.
I have numbness here. Is the nerve give you the problem? And the deal with the nerve is not enough. Going to where? Going to the marrow. Because all the nerve marrow is the nerve root is coming from the marrow. The marrow coming from where? Is coming from the brain. So we do for the complaint area. If the complaint area, we didn't see good results, or the results is not satisfied by me, then I'm going to the spine. If the spine still doesn't see the good result, go to the brain.
Okay.
So we are going to knock the brain. You have to wake up. You know, one part of the brain we call the thalamus.
Okay.
Generally 1 month, 2 weeks, because after the treatments, we also verify from the laboratory to see how is the ESR, to see how is the liver function, kidney function, heart function, also depending on the ECG report. If you see early sign, quickly go to see your doctor. Don't be ignoring the early sign of the stroke when we are talking about the stroke.
Okay.
Especially you have to concentrate for whoever have a stroke in your family. Then really you have to pay attention for yourself. A special offer, we can say I'm already a Ghanaian. We always do something for our patients.
Okay.
If our old customer or old patient, when you're coming to Beijing clinic, you bring your people within 2 weeks, like when you see this program, within 2 weeks, consultation for free.
Okay.
Acupotomy for those simple diseases we can make for 2 times for free. We have some diagnosis from the tongue, give you the tea for 5 days for free. And also, whoever see this problem, you are welcome. We'll try our best to help you.
Okay.
Also the same condition.
Okay.
Acupotomy, if you have simple disease, we'll try to do our best, even give you for free.
Okay.
And also the tea we can give you for free for 5 days.
Okay.
If everything for free, we can't be afford because everything import from China.
Right.
And when we talk about expenditure, for my mind, I think we are very cheap compared to China.
Okay.
When we do one time in China, acupotomy is like, when we calculate in Ghana cities, it's 1,000 Ghana cities for each section. But here we just, 1,000 times, 1,000 Ghana cities. But when we are here, you know, people are complaining, and a lot of people that have no money, and deeply from our heart we want to give a help. Office number is 0302779649.
Okay.
Is our office number.
Okay.
Then we have a staff number 0244 26 20 78. Website is Beijing clinicghana.com, and the email address is beijingclinic@yahoo.com.